Okay, for this short video, we'll be covering Addison disease. Again, these videos are meant to enhance your reading. It's just to supplement what you're already reading and help you with your critical thinking. So Addison disease, this is the disease of the adrenal uh, gland. So the adrenal cortex, the outside part of the adrenal gland. So with Addison disease, the adrenal gland is hypofunctioning. It's not functioning in full capacity because the adrenal cortex produces hormones like cortisol and aldosterone. With Addison disease, which is hypofunction of the adrenal gland, there will be zero production of cortisol. Again, what is cortisol? Cortisol is a steroid hormone. It helps the body manage its stress appropriately. So a patient with Addison disease cannot manage any kind of stressful situation on the body. I mentioned in my last recording that a stressful situation could be where there's electrolyte imbalance. I'll also add that a stressful situation can be, for example, in a car accident. Okay. And for a patient with Addison disease, because they're not producing any kind of steroids, they need to be supplemented when it comes to steroid, like give them IV steroids, for example, hydrocortisone IV. The body is not able to manage those kind of stressful activities. So therefore, this patient will be needing medication, okay, to be able to manage stress that a regular person would have just managed easily. So to put all this together, Addison disease is it decreases cortisol and aldosterone, depletion of cortisol and aldosterone levels, which these are hormone. What is aldosterone? Aldosterone helps in fluid and electrolyte balance, especially in the kidneys, fluid and electrolyte balance. So when we talk of fluid and electrolyte balance, we are now talking of helps to manage blood pressure and all of that. Those vital signs that it comes like it's those automatic processes in the body, like blood pressure and all of that. You can't tell your heart to beat and stuff like that. Those automatic responses. So aldosterone helps to manage that fluid and electrolyte balance. Some key clinical findings when with Addison disease patients is that because the adrenal gland is hypofunctioning, if you start looking at the labs, they'll have we're talking of steroid, right? Cortisol, no cortisol. So therefore, hypoglycemia. Okay. So zero sugar, hypoglycemia. Okay. No steroid at all. But then hyperkalemia. Hyperkalemia, high potassium levels, low sodium levels. Okay. So I want you to establish the fact that when in the adrenal gland specifically, when the potassium levels, potassium and sodium, if potassium is high, then sodium will probably be depleted. Okay. For Addison disease, potassium levels are high, therefore sodium levels will be low. Okay. So low sodium level, low blood sugar levels, hypoglycemia, so hyponatrimia, hypoglycemia, but then hyperkalemia. Okay, hyperkalemia. With all of these, the patient is experiencing extreme weight loss. They're losing a lot of weight. Okay, then they have hyperpigmentation of the skin. What do we mean by hyperpigmentation? Specifically, your textbook says they have a bronze skin. Okay, there's bronze skin, hyperpigmentation of the skin. And then with all of this, they'll experience lots of fatigue. So imagine a body that has zero steroid. They can't tolerate stress. Any kind of stressful situation, they cannot tolerate it. And then they're just tired, easily tired, and all of that. So elevated potassium levels, hyperkalemia, hyponatrimia. Remember again, when the potassium levels are high, then sodium levels will be dropping. Hyponatrimia. Then hypoglycemia, there is no sugar. So as if you're able to figure out these lab values, now think of it. What kind of diet would you want to give this patient that in relation to these lab values that they're having? Okay, so what kind of diet do you want to give a patient? A patient that has low sodium levels, what kind of diet would you want to give them? A patient that has high potassium levels, what kind of diet would you recommend for that patient? Okay, so I'm just saying all of this to get you to thinking. So therefore, as nurses, we'll be monitoring for hypotension. Okay, hypotension and electrolyte imbalances. If a patient is experiencing hypotension, therefore their blood pressure is dropping, it means low volume, right? These are patients that we want to address it immediately. So addressing it could be that you're giving prescribed fluids to bring back the blood pressure up, or to add volume, or you're notifying the physician. So we have to address it specifically. Then also, as nurses, we'll be educating these patients. The number one thing for education is medication compliance. So if you think of it, a body cannot really stay without steroids. We all need steroids, right? But with Addison disease, there is no steroids. So they have to supplement steroids. So we're teaching them about their medication compliance. So we're teaching them about hydrocortisone IV. Okay. If we're giving them in emergency situation, they'll give them hydrocortisone IV. They'll give them IV steroids, and then with fluid. So we're teaching them medication compliance, and then we're teaching them the importance of corticosteroids, that's steroids, the importance of the use of steroids. Okay, so if they prescribe this patient something like prednisone to go home, if they're in a acute care facility, they prescribe them prednisone. So you're teaching them that you cannot just keep your medication like that. Your body is not producing any kind of steroid, so you need steroids, so you will not just keep your medication. Also, we want to teach them not to stop steroids abruptly. If they stop steroid abruptly, what will happen is that they will go into Addisonian crisis. They'll go into a crisis situation. Okay, and then of course, I mentioned about bronze skin because they have hyperpigmentation of skin. We're looking, because we're doing holistic care, right? So we're looking at the psychological aspect of care. Because of hyperpigmentation, how do they feel about their physical body? Is it the kind of patient that you want to support them psychologically because of their skin? Okay, so again, look at the labs. What kind of labs are we experiencing with Addison disease? Based on those labs, what kind of diet can I give my patient based on the labs? And then most importantly, we're teaching this medication compliance. They need steroids. We're teaching how they should comply with the steroids, and they can never just stop steroid abruptly because it will cause more situations. So that's just general points to help you answer these questions on Addison disease, and to help you as you study. Okay, thank you.